Fluctuating sugars are the most worst for the progression of diabetic retinopathy. Immediately need to stop smoking because that also affects the small blood vessels in the retina. Obesity is a risk factor. You need to do diet, exercise and a healthy lifestyle to prevent the progression of diabetic retinopathy. Hello everyone, welcome to Retina Connect. So we had spoken about the risk factors of diabetic retinopathy. So in this video, let's look at how we can prevent the onset or delay the onset of diabetic retinopathy or prevent its further progression to a later stage of diabetic retinopathy. So in this, we know that this retinopathy happens as a secondary complication or secondary effect of diabetes, uncontrolled diabetes for a long term, like how people develop diabetic nephropathy, kidney disease. So we cannot control the chronicity, but the most important thing that we can do is to maintain a good glycemic status. So now what is the good glycemic status? One reading of normal fasting sugar or one reading of normal postprandial blood sugar doesn't mean anything, because it has been shown that fluctuating sugars are the most worst for the progression of diabetic retinopathy. So what we should look at, some indicator like glycosylated hemoglobin, popularly known as HbA1c, which gives a 2 to 3 months average sugar. Diabetic retinopathy purpose, you should aim for a glycosylated hemoglobin HbA1c level of 7% or less. So that would be ideal. And then the other comorbid conditions like hypertension, blood pressure controlled, cholesterol, hyperlipidemia controlled. If you have nephropathy, control of microalbuminuria, anemia, where hemoglobin is less, all those have to be kept under control. All these comorbidities needs to be controlled so that the retinopathy doesn't progress to a worse stage. And there are lifestyle modifications, immediately you need to stop smoking because that also affects the small blood vessels in the retina, smoking. And then even pregnancy has been shown to worsen the diabetes and diabetic retinopathy. So need at least couple of regular follow-ups during pregnancy and up to 1 year after the childbirth. And even obesity is a risk factor. You need to do diet, exercise and a healthy lifestyle to prevent the progression of diabetic retinopathy. So once again, I stress the importance of having your HbA1c, glycosylated hemoglobin, at a steady level. That is the best to prevent the progression. Thank you once again for your kind attention, and I hope it was helpful, and see you in next video.